New York City Mayor Bill De Blasio shocked and surprised a lot of people today, announcing that now every New Yorker is guaranteed health insurance, including undocumented immigrants. Our own Nate Rogers was there as the mayor laid out his plan. Nate?
That's right, Bill. Mayor de Blasio says right now there are at least 600,000 New Yorkers without any form of health insurance. And instead of seeking preventive care, folks uninsured often rush to the emergency room, which should be the last resort and is much more costly.
Because no one should have to live in fear. No one should go without the health care they need. Healthcare is a human right. In this city, we're going to make that a reality.
Effective immediately, guaranteed health coverage for every New Yorker. The city is expanding Metro Plus, its public health insurance program, and adding New York City Care, which guarantees healthcare access to those ineligible for healthcare, including undocumented immigrants. The plan offers physical and mental health care, a primary care physician, specialty care, and covers all pharmaceutical costs. It also includes, quote, customer-friendly call lines to process patient requests.
You call 311, or you go online to the city website, and you can right then and there get your card and get the name of the doctor. It's as simple as that.
I think it's a great idea because at least we know that so many New Yorkers will be covered.
My concern is that will we be bringing people from other states and we would have no way of knowing whether they are native New Yorkers, but they would be enjoying the system also.
Now, Bill, patients who can afford the coverage will be charged on a sliding scale. Those who can't afford it will get the services for free. Funding for the program will come from the city's current health and hospitals budget. An additional $100 million will be added to that budget. And also, Bill, health officials say once patients go on and register, they can sign up to see a physician within the next 2 weeks. They expect the program to roll out in full swing in the next 2 years. Bill?
Nate, did the mayor elaborate, and how did he define the ability to afford it?
They'll be looking at folks' income, tax returns. As you just said, they didn't really spell out exactly how, but those are a couple of things that they are considering.
Okay. Thank you, Nate. Appreciate it. All right, let's bring in our A-plus panel for tonight's show. We are joined by Republican strategist Jeanette Hoffman. Great to see you, Jeanette.
Thanks, Bill.
And Bill Caruso, attorney and Democratic strategist. Good to see you, Bill.
Hey, Bill.
All right, Bill, I'm going to start with you on this. If you're going to have an income qualifier, but you're going to allow undocumented immigrants in, and they're working for cash under the table, there is no effective income qualifier. How do you pay for something like this?
Well, I mean, they have a math problem to begin with. I think I heard a round number of $100 million, which will go only so far. I mean, the bigger problem, this is a good idea, but it's half-baked. What kind of education is going to go along with this? What are you going to do to get folks enrolled in this? And if the true focus here is to get people preventative care, you've got to drive folks to that level. It's not just giving them a card so they still show up in the emergency room and get covered.
Jeanette, we're not doing anything to address costs, the rising cost of health care. It's just we're going to subsidize it at this inflated level.
Bill, this is a slap in the face to every middle-class New York City taxpayer who can barely afford to pay their own health care bills and now are going to have to subsidize 300,000 citizens from other countries and pay for their health care. $100 million is just the tip of the iceberg, and it's going to go on the backs of hardworking New York City taxpayers.
Seems to me that you got to define it somewhere. Those that are destitute and can't provide, I get it. It makes sense. You got to help these people. But man, they left this one open-ended.